All right, party people, we are back at it with another one. Let's get it. All right, so today's topic is going to be mannitol and its effects on ADH and plasma osmolality. Let's get it. So, first and foremost, let's get into what is mannitol. So, at the basic level, at its core, mannitol is a sugar alcohol. We give it to increase plasma oncotic pressure. Basically, it raises the solute concentration in your blood. Think of it like glucose or albumin. It pulls water into the vasculature by increasing plasma osmolality. Now, as far as your licensing exams go, you need to be able to recognize these things in terms of plasma osmolality as well as ADH. So you have to know that ADH goes up as well as plasma osmolality. Now, ADH is released in response to increased serum tonicity. So if osmolality goes up, ADH is secreted from the posterior pituitary, and that's as simple as it gets. So if they give you a chart, like they sometimes do, we're going to be picking up and to the right, because both X and Y axes would be high. Now, what I have to point out is a lot of times students will overthink this. They'll say things like, wait a second, mannitol draws free water from the interstitium and brain into the blood. Could this dilute the sodium and decrease the ADH? Or they'll sometimes ask, mannitol increases the plasma volume, shouldn't that decrease ADH? Here's the fun fact that you have to remember to be able to answer these questions. The effect of increased osmolality outweighs both of those arguments. ADH secretion still rises because the body prioritizes correcting tonicity over volume changes. Mannitol will never decrease plasma osmolality. Even as water shifts, the net effect is an initial spike in osmolality, then a gradual return to baseline, but it will never drop below normal. All right, so let's refresh what we just went through. What is ADH doing here? ADH inserts aquaporins into the distal nephron, specifically in the medullary collecting duct. This is to increase free water reabsorption. So even if the plasma volume goes up, ADH secretion remains elevated because serum osmolality is the primary driver. All right, we're going to give you some extra factoids for bonus points. Licensing exams, the USMLE likes to test these. So once again, mannitol is an osmotic diuretic. It acts mainly in the proximal straight tubule and thin descending loop of Henle. If you see a nephron diagram, those are your go-to choices. Mannitol draws water into the nephron, increasing urine output. Now, as a caution, you do not give mannitol to patients with heart failure. Why? The initial spike in plasma volume can worsen the preload. This would exacerbate the heart failure, even though mannitol eventually decreases plasma volume through diuresis. Now, we have to review ICP, that's intracranial pressure. For cases with increased ICP, first, step number 1, you will intubate and hyperventilate your patient. This is to decrease their CO2. This is to result in permissive hypocapnia, where you have your CO2 at and around 26 to 33 millimeters of mercury. This reduces cerebral perfusion and ICP. Step 2 is to give mannitol. That's also to draw water out of the brain. So the key USMLE takeaway, you always hyperventilate first before mannitol in ICP scenarios. USMLE loves this. You have to know it. Let's spin the block and drive all this home. Mannitol increases plasma osmolality. This stimulates ADH. This in turn increases water reabsorption in the distal nephron. Mannitol acts as an osmotic diuretic in the PCT/thin descending loop. Do not use mannitol in heart failure. This is due to the acute increase in plasma volume. This would put undue stress and preload on the heart. What you will use mannitol for is for intracranial pressure after, I repeat, after intubation and hyperventilation. So for your licensing exam, you're going to be thinking osmolality first, ADH second, then diuresis. That is how we concisely cover mannitol. All right, if you like the video, comment, share, and subscribe. And check out my Substack. That's going to be linked in the description box below. Share it with a friend. If there are any other topics you'd like me to cover, please feel free to leave them in the comments, and I'll see if I can make a video about them or a Substack article. Let me know. All right, go crush it.